Hello everyone, I am Dr. Krishna Reddy Taduri, Consultant Endocrinologist, Medicover Hospital, Madhapur. Today I would like to discuss regarding the type 1 diabetes. This is the most common type of diabetes which we commonly see in the children age group. So this is a very peculiar form of diabetes. Unlike in adult diabetes, these children does not produce any insulin in their bodies. So they completely, for their survival, they will depend only on insulin. There is no medication will work on them. So we see a lot of patients with the type 1 diabetes, especially the incidence being almost 10 to 20 patients for every 1 lakh of the population. We see that very commonly, and this is the very difficult part of the management because of the lack of in body production of the insulin. So they generally they will depend on the exogenous insulin administration. So to have a proper titration based on their meals and carbohydrate counting and insulin doses, they should have a proper knowledge about diabetes and proper knowledge about their diet and proper knowledge about exercise effects on their glucose control and sugars. So we generally, this is autoimmune disorder because of the autoantibody formation against their beta cells, which can damage their pancreatic beta cells, which are the cells producing the insulins. And the major deadliest complications of this type 1 diabetes is the diabetic ketoacidosis. With the lack of proper insulin inside the body, their body will tend to produce the keto acid, which is very dangerous for the body. So to tackle this, they should have maintained their insulin and sugar levels in the body appropriately, and based on their diet, and they should able to manage their day-to-day sugar levels. So in the latest technologies in type 1 diabetes management, we generally use basal bolus regimens for majority of the children. So for 3 meals, they should have a 3 proper prandial insulins and 1 basal insulin to tackle the basal levels of the insulin levels in the body. And the latest technologies have been developed in the type 1 diabetes, especially in the form of insulin pumps and continuous glucose monitoring systems, because these are the patients more prone for the hypoglycemias and hyperglycemias. These continuous glucose monitoring systems will give us a better outcomes. We will be knowing it exactly at what time the sugars are going down, exactly at what time the sugars are shooting up, what food they are consuming, at what level of sugars they are going up, and what physical activity, what is the effect of glucose on the physical activity. We will be seeing all this type of with the CGM data for the next 2 weeks. So this CGM is nothing but a small sensor which will be continuously senses your interstitial blood glucose every 15 minutes. So which will give the results to your either smartphone or to the sensor. And based on this, we can adjust the doses of your insulin's basal levels, especially if you are an insulin pump. This is a pump which will be attached to your into the subcutaneous tissue. It will continuously deliver the insulins, and it is also have a button to push for your prandial needs of insulins can be addressed with this insulins. The latest generation of the insulin pumps along with the CGMs have been coming. So which is continuous glucose monitoring data will be pushed to your insulin pumps, which can be translated, which can auto adjust their insulin injection into the body. So which has a very much advantages in tackling this hypoglycemia and hyperglycemias. So to have a proper control, your sugar should be at least 75% of the sugar times it should be in the range of 72 to 180 milligram per deciliter. And as far as possible, you should avoid the hypoglycemias, and you should take a proper diet, and you should not change your carbohydrate ratios in the foods, and you should have a regular dietary exercise programs. And with the regular monitoring is very key for the success in type 1 diabetics patients. These children should be very well educated regarding insulin techniques, especially Some of the patients, they will be keep on giving insulin at the same point, which leading to the lipohypertrophy complications, which will lead to the erratic absorption of the insulins, and which will lead to the hypoglycemias and hyperglycemias. So that's why there should be a continuous education for these kids, and continuous monitoring for them for their whether they are taking insulin. Especially adults and type 1 diabetics, they may averse towards the skipping of the insulin. Even a single dose of skipping of the insulin, that can land up in the problems like developing of the keto acid building up, and they may go into the diabetic ketoacidosis. And you should also take care of their growth. If you want a proper growth, they should have a proper glycemia control, that should target HbA1c of 6.5 to 7 based on their age group and based on the brittleness of the diabetes. And they should avoid the hypoglycemias. They should also have regularly check for the other autoimmune problems like hypothyroidism or any adrenal insufficiency, celiac diseases. So you should tackle everything as a whole, and then only they can have a proper growth, and they can grow as a normal children.